When I was a young nurse working in Saudi Arabia, one of my patients asked me about my faith. Curious, I asked her why she needed to know, and she said, "My husband is looking for a second wife. And you look like you would have strong sons." People have told me a lot about how I look, but never in relationship to putting forth strong sons. But she was right. I had given birth to two big, beautiful boys. I never even knew I was pregnant. I never had the obligatory morning sickness. I never lost my appetite. Well, I wish I would have lost a little bit of appetite, but none of that ever happened. And so I had a great life as a mother. I was indeed a baby making machine. It's easy when you don't hurt, you don't swell, you don't do any of those things. The first time I was in labor, my neighbor knocked on the door at 2 a.m. and she said, "Valda, it's time to go. It's time to go." I said, "What is wrong with you?" She says, "You're in labor. Let's go to the hospital." I said, "What are you talking about? I don't have any pain. Nothing is dropping out." She says, "Let me tell you first, we were so poor and lived so close that when I turned on my bathroom light, it woke her up. She said, 'You have been up and down to the bathroom all night long, and I need to take you to the hospital so I can get some sleep.'" We went to the hospital, and guess what? Baby boy number one was born. 4 years later, my sister cousin Brenda had made me this amazing dinner of Southern food, and I thought, "Ooh, so glad I'm not eating my own cooking." And so, as I was about to dig in, she says, "Girl, you are in labor." Wait a minute, I am fine. I don't hurt. Nothing is going on. She says, "Your color has changed." Knowing about the first one, I didn't argue, went to the hospital. Second baby boy was born. So this baby making machine was the ideal person for the Saudi woman, or it would have been 5 years before. After I had my second son, he was diagnosed with a heart defect and was rushed away to a neonatal intensive care unit. That was 30 miles away. Being poor, not being able to get back and forth, I didn't even get to see him the way that I wanted to. However, he did really well, and in 10 days, he came home. When it was time for my 6-week checkup, however, things were not going as well. I said to the doctor, "You know, the bleeding that starts right after you have the baby is still going on, and just as much." He said, "Well, of course. You have had a baby who has problems. You are probably concentrating nonstop on his health, and your health can't get back to normal." Okay. The next month, still using a lot of equipment to keep stuff from overflowing, I told him, don't worry, it will calm down." Third month, fourth month, and fifth month, when I looked so bad, I had dark circles under my eyes, my hair had turned to straw. I was confused, I didn't know what to do, to the point that my family had moved in with me because they thought I had postpartum depression. When you have postpartum depression, there is an opportunity and sometimes a likelihood that you will hurt yourself and you may hurt your child. So I had the whole posse rallied around because I literally couldn't do anything. So I said to the person on the phone, "I need to see the doctor, and I need to see the doctor today." Her response was, "You know, we have talked about you, and if you would stop being so hysterical, your body would probably get back to it." So, I might be hysterical, but I really, really feel bad. "Well, the doctor was on vacation, so you'll have to wait a week." Look, I am really in trouble here. I feel so bad. I don't know if I'll make it till next week. So I could basically feel her eye rolling through the phone when she said, okay, there's a new doctor here. He really doesn't have any patients, so I guess he can see you." I went in to see that doctor. He walked in. He took one look at me. He hurriedly did some tests, went out of the room, and came back in visibly shaken. Here's a secret. If healthcare workers come in looking shaken, you're in a world of trouble. He said, your hemoglobin is 4.8. You may not know it, but whenever it's under 5, there's a likelihood that you'll have heart failure or you may die. All this time, I have been begging for help and always told, it's fine, it's normal, don't worry. And so I didn't. But now this doctor is going into action. They're doing all sorts of interventions, this thing, that thing, and guess what? None of them work. So at the tender age of 23, I had to make the decision of saving my life or saving my womb. This baby-making machine was no more. This is unfortunately something that goes on in these United States far too many times. We have numbers like this. We in the rest of the developed world are not looking very good. As you can see, we are having our mothers to die. Why is it in a country like the USA with all of the wealth, all of the opportunities, all of the people with talent, why are our mothers dying? And then if you look closely, you will see not only are our mothers dying, but our Black mothers are dying even more. And then if you look at this chart, you will see that while we often hear that Black women are more likely to die, somehow they don't talk about our Native American sisters. As you can see this chart, they are much more likely to die. Something is really wrong, and we can be the solution. First, do no harm. That comes from Hippocrates, somewhere in there. There's a lot of discussion. Did you say it this way? Ultimately, what he said was, if you can't do good, don't do harm. It's like your mama said, if you can't say nothing nice, don't say nothing. So as healthcare providers, we have a responsibility to do the best that we can. And if we cannot do it, get somebody else. There are other people who can do it. So first, do no harm. And here's the shocking statistic. We have 700 to 800 women a year dying here in the USA. According to everybody who knows, most pregnancy deaths are preventable. Most. That's from the CDC, and they like numbers. So when they say most, they want y'all to get it. Every pregnancy where there is a death, there are 70 more pregnancy-related negative outcomes. That could be a stroke, it could be a heart attack, it could be anything that will make you go from being a healthy woman who's pregnant to someone who can barely take care of yourself afterwards. The March of Dimes says 80%. 80% of all those deaths could be prevented. And to go farther, it is known that for those who die based on behavioral, psychological, stress type things, 100% of them could be prevented. And that's because we have to be there for them. They may not know how bad it's getting. And we may have to say, do you want to talk? Is there something I can do? How can I help? And now, when I talk to women all over the country, they tell me that when they go in with their concerns, their complaints, their questions, they felt that they are untouched, unheard, and unseen. What could be worse than that for someone who is bringing a life into the world? I mean, we're the only ones who can do it, right? Don't you want to protect us? And then you have the fact that if they get into the hospital these days, pregnant women are being turned away from the hospital even though it's illegal. So if you hear of that in your neighborhood, complain and check on the laws, because there are federal laws. That means you cannot turn a woman away who's pregnant. It's happening all the time. At least 100 women have died from being turned away because they were pregnant and didn't meet some criteria of some person. So harm is being done. we have to do no harm. And then, how do we get there as consumers? How do we do no harm? We can sit there and say, oh, those doctors, those nurses, those midwives should do better. However, all of us have a responsibility to be involved because health is a partnership. It's not you passively sitting there and hoping someone would say what you need them to say. And then many of you go to see your healthcare providers and you lie. Yes? Anybody want to admit it? You go in there and you lie. You don't tell them things, or you hope they'll figure out things, that they have a divining rod or a crystal ball that will say, yeah, I did drink too much, smoke too much, other things. As consumers, we can do things like taking care of ourselves in a good way. In providers, we can do it by making sure that we listen. Many providers get so busy doing the technical stuff, they don't really listen. First of all, we're really in bad shape in healthcare. So if you go to see somebody and it's an emergency, take somebody with you. Because when you're unable to speak, how will they know what's going on if you don't have a relationship with them? Providers, during COVID, 20% of the medical professionals hung up their shingles and put their stethoscopes away because it was too much. The system is not made for the stresses of COVID, but we were already short of critical people in the perinatal space. Midwives, obstetricians, doulas. Policymakers, can they do better? Yeah, they can step up when those folks are being turned away from the hospital and dying in the waiting room of the hospital, or having their babies in the car and bleeding to death. These are all real things. We are the people who make the policymakers accountable. Yes? So let's do it. When you hear these stories, don't just say, oh, wow, that's terrible. Call someone and say, who can I talk to about this? And then employers are doing harm because there are many people who are especially vulnerable who, when it's time for them to go to, for their employees to go to get their maternal care, to get their prenatal checks, they're being told, okay, you can go if you want to, but you may not have this job when you come back. So you have to choose between going in and knowing what's going on. A good friend of mine has a daughter who, when she went to her prenatal visit, just a 36-week prenatal, she had very high blood pressure, preeclampsia, and that can hurt the mother and the child. But if she had not gone for that simple checkup where she knew she felt well, both of them may have died. So, when a mother dies, so much happens. The baby may never know the love of that person who is just for them. Your family is disrupted because who is going to take care of the child? What if he or she is institutionalized for life? And then we can do simple things, educational things. Keep your mothers healthy. Have this, talk to the mothers. Have it in community centers where you're talking to the grandmas, the aunties, all the people who think they know and maybe giving you some bad information. Learn it from people who know, and we can make sure, open up your businesses so that folks can come in for these talks. And then what do? Know the danger signs. Severe headache, extreme swelling of your hands and feet, trouble breathing, heavy vaginal bleeding, overwhelming tiredness. That means right now, go see somebody. Not later, and demand it. Don't be like me begging for 5 months. Demand it. It's your right. And finally, we want to get people to the point that they feel touched, heard, and seen, because we want to do no harm. You can make a difference by telling 10 people what you heard about today. Have them tell about 10 more people. And then for all of you who are good at social media, put it out there to all your folks. And who knows, maybe 1,000 people will learn today that if we decide that we want our mothers to live, if we decide that we are partners in healthcare, and if we want to see that having healthy mothers make healthy babies, which create healthy communities, we can make all that change if we first do no harm.